The liver, a large meaty organ, sits silently in our right upper abdomen. It works tirelessly, a chemical factory with over 500 functions. It filters toxins from our blood, produces bile for digestion, and stores energy. It is essential for life, yet this vital organ is vulnerable to attack, including the stealthy invader Hepatitis B. Hepatitis B, a viral infection, targets the liver. It can cause inflammation, damage, and even liver failure. The virus, microscopic and cunning, can persist in the body, leading to chronic infection and long-term health problems. Understanding this enemy is the first step in protecting ourselves and our loved ones. The liver, resilient yet susceptible, needs our help to fight this battle. Through knowledge and awareness, we can combat hepatitis B and safeguard our health. Join us as we delve into the world of this silent epidemic and learn how to protect ourselves and our communities. Hepatitis B, a DNA virus, is a member of the Hepatnaviridae family. This virus specifically targets liver cells, called hepatocytes. The virus is cunning. It enters these cells and hijacks their machinery. It forces the cells to make copies of itself, spreading the infection throughout the liver. This invasion triggers the body's immune response. Immune cells rush to the liver, aiming to destroy the infected cells. This battle between the virus and the immune system causes inflammation, the hallmark of hepatitis. The severity of this inflammation and the body's response determine the course of the infection. The virus can be present in various bodily fluids, including blood, semen, and vaginal fluids. This makes understanding transmission crucial for effective prevention. We will explore the various routes of transmission in the next section. The fight against hepatitis B is a race against time. Early detection and intervention are crucial to prevent long-term liver damage. Hepatitis B spreads through contact with infected bodily fluids. It is not casual contact, it requires direct exposure. The most common modes of transmission include blood-to-blood contact. Sharing needles, syringes, or other drug paraphernalia is a high-risk activity. Accidental needle stick injuries in healthcare settings also pose a risk. Sexual contact. Unprotected sex with an infected person can transmit the virus. This includes vaginal, anal, and oral sex. Mother-to-child transmission. Infected mothers can pass the virus to their babies during childbirth. This is a significant route of infection in regions with high rates of hepatitis B. It's important to note that hepatitis B is not spread through casual contact like hugging, kissing, or sharing food, sneezing or coughing, breastfeeding, as long as proper precautions are taken. Understanding these transmission routes is vital for prevention. We must be aware of the risks and take appropriate precautions to protect ourselves and others. Simple measures like safe sex practices, avoiding needle sharing, and vaccination can drastically reduce the spread of this virus. Hepatitis B is a master of disguise. It can be silent with no symptoms for years, or it can manifest with a range of signs. These symptoms, however, often mimic other common illnesses, making diagnosis tricky. Some people experience acute infection, which lasts less than 6 months. They may have fatigue, loss of appetite, nausea and vomiting, abdominal pain, yellowing of the skin and eyes, jaundice, dark urine and pale stools. Others develop chronic infection, lasting longer than 6 months. They may have no symptoms initially, but over time the virus silently damages the liver, leading to cirrhosis, scarring of the liver failure, liver cancer, death. The silent nature of hepatitis B makes it a dangerous foe. Many people are unaware they are infected, putting themselves and others at risk. This highlights the importance of regular testing, especially for those at higher risk. Section 5. Acute versus chronic. Two sides of the same coin. Hepatitis B infection can manifest in two main forms, acute and chronic. The difference lies in the duration and severity of the infection. Acute hepatitis B is a short-term illness. Symptoms, if present, typically appear within a few weeks of exposure. Most adults with acute hepatitis B recover fully, clearing the virus from their bodies. Their immune system successfully fights off the infection. Chronic hepatitis B, on the other hand, is a long-term battle. The virus persists in the body, leading to a chronic, lifelong infection. Over time, this persistent inflammation can silently damage the liver. This damage can lead to scarring, known as cirrhosis, liver failure, liver cancer, and even death. The younger the age at infection, the higher the risk of developing chronic hepatitis B. Infants infected at birth have a 90% chance of developing chronic infection, while adults have a much lower risk, around 5%. This underscores the importance of vaccination, especially for infants. Section 6. Diagnosis. Unveiling the hidden enemy. Diagnosing hepatitis B is like detective work, requiring a combination of tools and investigations to uncover the silent invader. Doctors use a three-pronged approach. First, the medical history. Doctors ask about symptoms, risk factors, and travel history to assess the likelihood of infection. Next, the physical exam. They examine for signs of liver inflammation like tenderness in the right upper abdomen or jaundice. Lastly, blood tests. These are the most reliable way to diagnose hepatitis B. Different blood tests detect specific markers of the virus, indicating current or past infection. There are several types of blood tests for hepatitis B. The hepatitis B surface antigen, or HBsAg, indicates current infection. The hepatitis B surface antibody, or anti-HBs, indicates immunity from vaccination or past infection. The hepatitis B core antibody, or anti-HBc, indicates past or current infection. Early diagnosis is crucial for effective management. It allows for timely intervention, preventing or slowing down liver damage and reducing the risk of complications. Section 7. Global impact. A silent epidemic. Hepatitis B is a global health problem, affecting millions worldwide. The World Health Organization estimates that 2 billion people have been infected with the virus and over 250 million live with chronic infection. The burden of this disease is not evenly distributed. Regions with limited access to healthcare and vaccination programs like Sub-Saharan Africa and parts of Asia bear the brunt of the epidemic. In these areas, mother-to-child transmission remains a significant driver of new infections. The consequences of this silent epidemic are devastating. Chronic hepatitis B is a leading cause of liver cirrhosis, liver cancer, and liver-related deaths worldwide. It accounts for an estimated 887,000 deaths annually. The fight against hepatitis B requires a global effort. Increased awareness, improved access to testing and treatment, and widespread vaccination are crucial to curb this silent killer. Section 8. Prevention, our strongest weapon. In the battle against hepatitis B, prevention is our strongest weapon. By understanding the virus and taking simple precautions, we can protect ourselves and our loved ones. Vaccination is the most effective way to prevent hepatitis B infection. The hepatitis B vaccine is safe, effective, and provides long-lasting protection. It is recommended for all infants at birth and for children and adults who have not been vaccinated. Safe sex practices are crucial in preventing sexually transmitted infections, including hepatitis B. Using condoms consistently and correctly during sexual activity significantly reduces the risk of transmission. Avoiding sharing needles or other drug paraphernalia is paramount. Shared needles can transmit blood-borne viruses like hepatitis B. If you use injection drugs, seek out needle exchange programs and safe injection sites. These simple yet powerful steps can break the chain of hepatitis B transmission and protect countless lives. Prevention is an investment in our health and the health of future generations. Section 9. Vaccination, a shield against infection. Vaccination is a cornerstone of public health, and the hepatitis B vaccine is a shining example of its power. It represents a safe and effective way to prevent infection and its devastating consequences. The hepatitis B vaccine contains parts of the virus's outer coat protein. These harmless fragments stimulate the body's immune system to produce antibodies against the virus. These antibodies act like soldiers, ready to fight off the actual virus if it enters the body. The vaccine is highly effective, providing long-lasting protection for most people. It is typically given as a series of 3 doses. Infants usually receive their first dose at birth, followed by 2 more doses within the first 6 months of life. The hepatitis B vaccine is safe for most people. Side effects, if any, are usually mild and may include soreness at the injection site, low-grade fever, or headache. Vaccination is not just an individual choice. It's a collective responsibility. When enough people are vaccinated, it creates herd immunity, protecting even those who cannot be vaccinated. Section 10. Real-life stories, triumphs and challenges. Behind the statistics and medical jargon lie real people whose lives have been touched by hepatitis B. Their stories illustrate the human toll of this silent epidemic and highlight the importance of prevention, early detection, and ongoing care. Meet Sarah, a young mother who unknowingly contracted hepatitis B during childbirth. She lived for years without symptoms, unaware of the silent battle raging within her liver. By the time she was diagnosed, the virus had caused significant damage, leading to cirrhosis. Sarah's story underscores the importance of routine testing and early intervention. Then there's David, who contracted hepatitis B through intravenous drug use. He battled addiction and the stigma associated with the virus. However, with the support of healthcare professionals and community organizations, David overcame both challenges. He accessed treatment, achieved viral suppression, and now dedicates his life to advocating for others affected by hepatitis B. These stories, while just a glimpse into the vast tapestry of human experiences with hepatitis B, remind us that behind the disease are individuals facing unique challenges and triumphs. Their resilience and determination inspire us to continue the fight against this global health threat. Section 11. The future hope and continued vigilance. The fight against hepatitis B is a marathon, not a sprint. While significant progress has been made in prevention, diagnosis, and treatment, challenges remain. Continued vigilance and a multifaceted approach are crucial to ultimately eradicating this silent killer. Research continues to advance our understanding of the virus and develop new therapies. Antiviral medications can effectively suppress viral replication, slowing down liver damage and reducing the risk of complications. Scientists are also exploring new treatment approaches like gene editing and immune-based therapies to achieve a cure. Global efforts to eliminate viral hepatitis are gaining momentum. The WHO has set ambitious targets to diagnose 90% of people with hepatitis B and treat 80% of those eligible by 2030. Achieving these goals requires sustained commitment from governments, healthcare providers, and communities worldwide. The future holds both hope and challenges. By working together, raising awareness, expanding access to care, and supporting ongoing research, we can turn the tide against hepatitis B and create a healthier future for all.